I would like to welcome you to this launch and also to thank you most sincerely for taking your time to share with the Council of Governors and the former CIC team the launch of the booklet that will support counties in implementing health as a devolved function. The former CIC will be also handing over a project report on a pilot that they have undertaken in 3 counties to actually testify on what is working in terms of health provision. The guide booklets will go a long way in making work easier for county administration as it attempts to shed light on the legal provisions on implementation of the devolved function of health. The rights-based approach to service delivery is well expounded in the reports, and it is very important that everything that we do, we embrace the right-based approach, because it always asks who has been left behind, why has that person left behind, and what should be done, and what is the role of the duty bearer in ensuring that the person is not left behind.
The guide actually is aimed to assist the national and county government to effectively implement their respective mandates in a manner that respects the letter and spirit of the Constitution. The guide itself is divided into 7 chapters. The first chapter, it talks about the key tenets of the Constitution. Chapter 2 talks about the right to health in the Constitution, the international frameworks in regard to the right to health, and the obligations of the state. Chapter 3 of the guide, it speaks on the structures and mechanisms of implementing the right to health. Chapter 4 also speaks on health financing. We have the funding by the national government. Chapter 5 of the guide speaks on the values and principles of the Constitution and the application to healthcare, while the last chapter of the guide speaks on the role of non-state actors in delivery of health services, such as NGOs, FBOs, among others.
So we picked health facilities, and these are hospitals. So even within the health sector, this is limited to the health facilities. The UN Committee on Economic, Social, Cultural Rights has given indicators, a guide on how you measure if people are enjoying human rights. And for the right to health, they have given 4 indicators. We have to measure issues of availability, that is availability of the health services. So we would look at the health infrastructure, we would look at the staff who are there to provide services, we will look at the commodities and everything that will enable the delivery of health services. There is accessibility. Accessibility, you might have a hospital, but it is 100 kilometers away. It is of no use if this person is not able to walk to it. It is of no use to somebody who cannot afford to actually get the transport to go to that facility. There is also acceptability. Acceptability is about keeping within the ethical standards, respecting the dignity of the people, treating people, being sensitive to cultural situations. And then quality, of course, is about applying the relevant standards. When we are talking about qualified nurses, there must be qualified nurses, and applying the skills that will deliver the services in a manner that is acceptable. So after data collection, there was data analysis, which was done. And then after that, we prepared the report and went back for validation in the counties. After validation, we then prepared the final reports, which we have. We found that most of the level 4s and 5s had ramps, but which were done as an afterthought, most of them. So people have not been designing health facilities with persons with disabilities in mind. So it is important that that happens.
This is not a research where CIC came and went direct to collect information. It has been a journey we have walked together for us to understand what is it about right-based approach.
I would like, on behalf of the county government of Kericho and the Council of Governors, to thank Danida most sincerely for the support it has given to counties. Danida, as far as governors are concerned, is the first donor to release funds in accordance with the Constitution. And we thank you very much. The funds that have been dispersed to all 47 counties have gone a long way to make a big difference in health delivery to the people of Kenya.
fair to say that the whole devolution process is a very important part of that. I think the new Kenyan constitution is a very progressive and very far-reaching document in terms of including a very impressive and ambitious Bill of Rights, and also the whole structure of the devolution of powers, of access to services closer to the people of Kenya. But of course, all these nice words needs very concrete and specific actions to be implemented. And that's why it has been a pleasure for us to be able to support the Commission for the implementation of the Constitution with the work that this Commission has been doing in integrating the constitutional values and principles, and also, as has been mentioned here, the rights-based approach in service delivery.
Hospitals have increased from 165 to 185, which is an improvement or an increase of 12%. Health centers from 481 to 555, an increase of 15%. Dispensaries have grown from 21%, from 1,585 to 1,925, thus improving access to health services, including maternal and child health care services.
But I want to say that this is really coming at the right time, because values in health sector have deteriorated over time. Let me take this opportunity to formally thank Danida once again. I know you have been thanked, but let me do it once again, because as chair of health, I have stood heads and shoulders above others in terms of implementation of health function, because the NEDA agreed early in time to ensure that we are fully supported as governors and as counties